A nurse practitioner is a registered nurse who has a significant number of years' experience, who undertakes a master's degree, that being either a generic master's and undertaking pharmacology and diagnostics, or a nurse practitioner master's, who then goes through a process of endorsement with APRA and is then, once endorsed, is then able to practice in an autonomous and also collaborative role, in an advanced practice and extended clinical role, still within the nursing framework. The knowledge and skills gained through their masters enables them to undertake tasks such as diagnostics, ordering and interpreting those, prescribing medication as appropriate, and also referrals to other health professionals. I think it's critical that a service undertakes some kind of analysis to look at that, having come completely through the process. There really needs to be organisational supports at all levels of the organisation, so that needs to be within the department that the nurse practitioner is looking at working in. It needs to be, so that clinical level, it needs to be beyond that, so all departments or all services that will have impact on that, and that includes services for me in palliative care such as pharmacy, diagnostics, the wards, the community services, a whole range of services. They need to consider the financial implications, obviously taking on an NP and bearing in mind all that an NP role is. So bearing in mind that that's not all direct clinical and taking that into account. We need to look at governance around NPs, so ensuring that organisations consider things such as their policies and procedures, so ensuring that the policies and procedures enable an NP to prescribe as clinically appropriate. It's also about position descriptions, so making sure that there are position descriptions for NPs that include all of these things. It's also about support though, which is probably the biggest thing once all the governance concerns have been addressed, and that's